Good afternoon you all. Welcome to the last session on mental health nursing, that is BNS 108. Today we will be covering block 2 unit 3, that is nursing management of a patient with schizophrenia, and we had an expert from Lady Hardinge Medical College of Nursing, Mrs. Annie Kumar. I welcome her and I hope you will really take full advantage of her because she is an expert in the psychiatric nursing. Before I ask her a question, just as per WHO, I would like to give you few facts about schizophrenia. That is, schizophrenia is a severe psychotic disorder, and although the incidence is very low, but the prevalence is high due to chronicity of the disorder. And 24 million people all over the world are affected by schizophrenia, and 50% do not receive appropriate care, and unfortunately out of those 50%, 90% live in the developing countries. But on the other side, if the care is provided in the initial stage, it is treatable, and this care can be provided by the family and the community. So now I think I should hand over to Mrs. Annie Kumar. She will explain us what does we mean by schizophrenia and what is the definition of schizophrenia. Mrs. Annie.
Thank you.
Please.
Schizophrenia, when you take the word meaning, schizo meaning is split and free meaning is mind. So you can say schizophrenia means the splitting of mind, or in simple words you can say it is a split personality. And according to DSM-4, the definition of schizophrenia is, it is a group of disorders manifested by characteristic disturbance in thinking, mood and behavior. It means all the aspects of human mind, that is thinking, mood and behavior, all are disturbed or disorganized. And the symptoms will last for at least a month of active phase, that is 2 or more of these symptoms will be present in the person for more than a month. For example, delusions, hallucinations, disorganized or catatonic behavior, negative symptoms, all these symptoms will be present in the person. And when we discuss about symptoms, we will go into the details of these symptoms. So you can say all the symptoms will lead to a disorganized personality of the individual, and that is why it is known as split personality.
So few of the signs and symptoms you have come to know through definition, but let me ask Mrs. Annie to explain us in general the signs and symptoms of schizophrenia, so that the terms which may be, some of the terms which may be new to you will be clear. Mrs. Annie, can you please explain the signs and symptoms, please?
Okay. Widely you can say schizophrenia symptoms can be divided into 2, that is primary or fundamental symptoms and secondary or the accessory symptoms. According to Blewers, he has described it into 2, that is primary symptoms. He had said it consists of 4 A's, or there are 4 symptoms which starts with the word A. Then first one is affective incongruity or affective disturbance, or there is disturbance in the mood pattern. Or you can say there will be inappropriate mood, in which the mood will be flat or blunt or no emotions. So you can say apathy. For example, you won't be able to make out what is the expression on the patient's face. You won't be able to make out patient is sad or patient is happy or angry. So the mood will be blunt. There can be inappropriate mood, there can be inadequate mood. The second A starts with associative looseness. It means there are no connections with the ideas expressed by the patient. The patient will shift from one idea to another without any connection. For example, patient will say, sky is blue, I like tea, that sister is nice. So he is giving many ideas but without any interconnection among the ideas. Then ambivalence. Ambivalence, that is experiencing two contradictory or opposing feelings towards the same person, object or a situation. For example, while talking to the patient, he may say, I like my father very much, he is responsible for all my success. Then later on in the interview, he may say, all my illness is due to my father, I am very disturbed because of the behavior of my father, I just don't like him, I hate my father. So he is expressing the two feelings, that is love and hatred towards the same person during the same time. That is ambivalence. Then the fourth A is autism. That is, thinking is not based on reality. Patient is preoccupied with ideas deriving from fantasy, and he shows detachment from the real environment. There will be muttering, laughing or crying without any apparent reason. In some books you can find a fifth A, that is auditory hallucination. Hallucination is a perceptual disorder. You must be aware by now that it is a perception without any stimulus. For example, patient may perceive, patient may hear something, patient may see something when there is no actual stimulus present there. So in schizophrenia, auditory hallucinations are very common.
Excuse me, Mrs. Annie, can you give just one example to the students? What is mean by auditory hallucination? Meaning, you have told one example you can give.
For example, patient may say, sister, somebody is telling me you are very bad and we want to kill you, or I am hearing voices in my ears that somebody wants to kill me. Can't you hear this? Then the nurse will be confused. What should I say to the patient? That the patient is hearing voices, but the nurse should know that it is a symptom. You cannot question a symptom, and for the patient it is the actual symptom. So you can tackle the situation by saying, okay, I may not be hearing, I know, but you are hearing because it is part of your illness, and with medication, with treatment, you may get rid of the symptom.
So we can go further for signs and symptoms of schizophrenia?
Now we come to the secondary or accessory symptoms. First of all, neologism. Neologism is a disturbance of speech, that is making of new words or phrases invented by the patient. Patient may say some words which you may not have heard before, and you may think, what is the meaning of the word? The person may give the words meaning according to his own invention. Then there will be withdrawal in the patient. Withdrawal means patient is using as a defense mechanism because he wants to be aloof, he wants to be separated, he wants to be isolated from the society. Then there will be disturbances in behavior. Disturbances in behavior you must have already studied. There are many, like stupor. Stupor means person will be still, even though he is not unconscious, but he will be still, he will be mute, he will not be responding to any of the calls or any of the environmental stimuli which you give. There will be waxy flexibility or catalepsy. It means person will maintain in the same position for a period of time. Echopraxia. Echopraxia comes under automatic behavior, in which the patient will imitate whatever behavior is shown in front of him. Then stereotype behavior will be there. Stereotype means it is one type of behavioral disorder in which the patient will do an activity again and again. Automatic behavior, again echopraxia, echolalia. Echolalia, in which the patient will echo the words or repeat the words or sentences told in front of him. There will be negativism. Negativism is, you can observe it in children also. When you call the children, come here, they may go away from you. So the same way, stuporous patients especially, they will show this negativism. When you ask him something, he will do just the opposite. For example, they keep the eyes closed, and you will say, you open the eyes, then the patient will close it tightly. Then there will be deterioration of appearance and manner. Patient is not at all bothered about the personal appearance or the manner in which they behave. Then second is disturbance in thinking and perceiving. Perceptual disorders, you know, there are two types of perception disorders, illusion and hallucination, and we have already explained that hallucinations are commonly seen in schizophrenic patients. Then disturbance in thinking, first one is associative looseness, which we have discussed in the 4A's also, that there are no connections between the ideas expressed by the patient. Yeah. Then there is delusions. Delusions are false fixed beliefs which are not shared by others. For example, patient will have paranoid delusions, like patient will say somebody is going to kill me. Patient is saying, I am hearing voices and I have a belief that so my wife is after my life, or she is poisoning me. And you will come to know that there is no such thing, but you cannot shake the belief of the patient because it is a delusion, it is a part of the symptom in the patient. Then patient will feel depersonalization. Patient will think that I am somebody else. Depersonalization is a mistaken identity in which patient can talk like somebody else, patient may behave like somebody, and patient believes that I am somebody else. Then there will be disturbances in speech pattern. For example, echolalia, which we have already said, that is words and phrases are repeated by the patient as is told by the examiner. If, for example, if you ask, how are you? Patient will say, how are you? And did anybody come to see you yesterday? The same sentence will be repeated by the patient instead of giving the answers. Then there will be clang association. Clang association means the patient is talking in rhymes. Like each sentence will have ending word which is similar to the next one.
And there is one feeling of grandeur in this schizophrenia patient. Can you explain what this grandeur means with example?
Okay. Delusions of grandiosity can be more observed in the patients of mania, but at times patients of schizophrenia also display this grandiosity delusions. In this case, patient will say, I am somebody very powerful, I am somebody very big, like I am Prime Minister of India, I can do anything, so why don't you come to me for this? Or the patient may think that he is some type of God, that I can cure you, I have all the powers in the world. So they may boast about their personality. That is delusions of grandiosity.
So you have seen what are the signs and symptoms, you have heard about signs and symptoms of schizophrenia, which will be helpful to you while you are doing assessment and planning care for the patient. Let us now understand what is the psychodynamics of schizophrenia.
Coming to the psychodynamics, you know, there are mainly three causes of mental illness. In the initial stages, you must have studied that the most important causes of mental illness is biological, psychosocial and sociocultural. And some way or the other, all these factors influence or give reasons to the cause of the illness. For example, in schizophrenia, it is mainly seen that psychosocial causes play an important part, in which when the interpersonal relationships are pathological, or there will be early deprivation of the mother, or when the child-mother bonding is not properly formed, then these things can cause in the later period of life schizophrenic symptoms in the child.
So now we have seen what are the signs, symptoms and psychodynamics. Let us come to the types. There are various types of schizophrenia. Let me ask Mrs. Annie to explain us the common types of schizophrenia.
Coming to the types of schizophrenia, there are different types of schizophrenia, but the most common ones only we will explain. First of all, paranoid schizophrenia. Paranoid, you must be knowing The word itself means suspiciousness. There is a type of personality also, you must have studied paranoid type of personality, in which the person is more suspicious, and they are not trusting anybody. And those type of personality also have a more chances of getting this type of disorder. Paranoid schizophrenia means in which the patient will have the primary symptoms already, then only you can say the person is having schizophrenia. But more evidently, the delusions will be present. For example, paranoid delusions. There will be persecutory delusions. Persecutory delusions means the patient is having the belief that people are trying to kill him, like somebody is poisoning him, somebody is harming him all the way. Then there will be ideas of reference, like the patient will always feel that others are talking about him. For example, two nurses, they may be explaining something else, they may be talking something else at a distance, but the patient will say, see, both of them are talking about me. So this is the symptom, ideas of reference, which is seen in the patient. Then they lack trust. They are not going to trust anybody. So it is very important for the nurses to develop trust in the patient. Then there will be jealousy, and also auditory hallucinations will be present in this type of patient, in which patient will hear voices that somebody is going to kill them.
The second is type of schizophrenia is hebephrenic. Can you put light on that?
Yes, hebephrenic, or it is also known as disorganized type of schizophrenia. It has an early onset. For example, at the age of 15 to 25 years there can be occurrence, and there is severe disintegration of personality in this type of schizophrenia. Emotionally the person will act indifferently, or he will be indifferent to others. Then there will be senseless giggling. For example, hebephrenic patients, you can simply say they have a silly smile always on their face. They will be giggling to self, and there will be inappropriate or shallow laughter on their face without any provocation or without any reason. You must be seeing people muttering to self and giggling and laughing. Yeah. So this is the type of schizophrenia they are suffering with.
So another type is catatonic, and there are two types of catatonic schizophrenia. So let us ask Mrs. Annie about catatonic schizophrenia.
Catatonic schizophrenia is characterized by disturbance in motor behavior mainly, and it also has an acute or sudden onset, and it also starts early in age, like we have said, hebephrenic at an age of 15 to 25 years of age. There are two types of catatonic schizophrenia. The first one is stupor, catatonic stupor, in which we have already explained stupor, but the main features are there is apathy, like you are not able to make out the expression on the patient's face, like you won't be able to tell whether the patient is sad, angry, happy. So it is a mask-like face the patient is having. Then the patient will be mute, like patient will not be responding to whatever stimulus is given to him. If you ask what is your name, or if you inflict some pain for superficially, then the patient will not be reacting to it. Then non-communicating. Then patient will be staring at you, or patient will be closing the eyes all the time. There will be waxy flexibility or catalepsy in the patient, like patient will be remaining in the same position, like patient will be lying still for a day also, it is possible. And when you go and take the pulse of the patient, you will take the pulse of the patient, mark it and leave the place. After some time, when you come and see that the patient will be, yes, the hand will be positioned in the same position you left. So you have to go and put the hand in the previous position. So this is catatonic stupor. Coming to catatonic excitement, this is wild behavior, mostly in unpredictable manner. For example, patient will be agitated, patient will be excited and violent. Aggressive motor activity without any emotional expression. Patient may suddenly attack people, destroys articles, tears clothes, and most important is it is unpredictable. You know that excitement is also seen in maniac patients, but the major difference between catatonic excitement and manic excitement is that In manic excitement, patient is already mood is elated, and you can always predict that the patient may become violent at any time. But in catatonic excitement, it is unpredictable. You will be taking interview with the patient, you will take talking to the patient, all of a sudden patient becomes violent and agitated.
And can you explain some other types, the simple and residual schizophrenia also?
Yes, the simple, or it is known as undifferentiated. Why? Because it has symptoms of all the categories of schizophrenia. So you cannot just differentiate it into paranoid type or catatonic type. Then residual schizophrenia means it is the most chronic form of schizophrenia. Client can be able to do his routine work because most of the symptoms will be subsided and there is social recovery. Patient can go back to the normal way of living, but some of the symptoms may be present, like blunting will be present, apathy, patient is expressionless, then there is social withdrawal, like patient will not be going to any of the social activities, patient will be aloof, patient will be leading an isolated life. Sometimes catatonic behavior will be there, IPR will be poorly maintained by the patient. All the symptoms will be present in residual schizophrenia.
So we have seen the relationship and the types of schizophrenia because it will really have impact on the medical and nursing management of the patient with schizophrenia. So what is the medical management of patient with schizophrenia?
Medical management, especially you know that psychotic illnesses are treated by hospitalization. Hospitalization is very important because the mode of treatment going for, or which is good for psychotic patients, are drug therapy, ECT and psychosocial therapies, and these are possible in the hospital environment. And the integrated approach is also very important, like the nursing management and conducive environment, social skill training, all these are required for schizophrenic patients. Hospitalization can decrease the stress also on the patients, and the family can also be taken into the care of the patient during hospitalization. Patient does not take care of any of the personal hygiene, nutrition, elimination, so all these can be taken care of in the hospitalization. Next is the integrated approach. Integrated approach means it is like giving the integrated treatment like drug therapy, ECT, psychosocial therapies. All are integrated, combination of all these three are given in the integrated approach. Then family interventions. Family interventions, as I have told you, the major reason of recurrence of schizophrenia or the symptoms are the withdrawal of family support. Most of the time, once the patient's symptoms have reduced, the family will take off the medicines from the patient, or they may think that the medicines are not required. So the family has to be educated to continue with the treatment and to give the full support to the patients. And
that means the role of family and understanding of the family about the disease is very important.
Very important.
So nurse has to play a very important role in this.
Yes. Then early treatment. You all know that when it comes to the treatment, the earliest treatment you give to the patient, the speedy recovery you can expect from the patient. So once the symptoms occur, you have to consult mainly whenever the patients will show some abnormal behavior. There is a tendency in the society that to hide the patient from the society, from the people. But it is always better to consult a doctor, take treatment and give the best result to the patient. Then coming to the pharmacotherapy. Pharmacotherapy is very important for schizophrenic patients. Once the antipsychotics have been invented, there is drastic change in the treatment of and the recovery of the mentally ill patients. And antipsychotics are the drug of choice for schizophrenia. There are two types of antipsychotics, typical and atypical antipsychotics.
Can you give some examples, 2 or 3 examples of the drugs?
Yes. Typical antipsychotics were used before, and the drugs, even now also they are commonly used. The drugs which comes under these are haloperidol, chlorpromazine, perfenazine, melaril, serentil, stelazine, all these drugs are used. But the major side effect of the drugs are EPS or the extrapyramidal symptoms. And there are other side effects also like orthostatic hypotension, agranulocytosis, photosensitivity, drowsiness. So the new drugs were invented which are known as atypical antipsychotics, which has shown a better tolerance in the patients and a less amount of EPS, extrapyramidal symptoms. The drugs which include clozapine or clozaril and Seroquel, Solaptril and Geodo. These are the commonly used atypical antipsychotics.
And can you tell something about ECT?
Okay. ECT is also found very effective in treating schizophrenic patients, especially catatonic stupor patients, paranoid schizophrenia, and we know that one of the most important indication of ECT is when you require a speedy change in the patient's recovery. Like in stupor patients, catatonic stupor, they do not respond to your commands, they do not eat anything, they do not take any nutrition. So in such conditions you require speedy recovery. So in such conditions ECT is very useful. And also for paranoid schizophrenia patients, they are harm to self and others. They are hearing voices, they are very suspicious. Sometimes patients will think that the patient next lying to him is going to harm him. So he may do something to the patient before he harms him. So he is a threat to other safety also. So in such conditions ECT is very helpful.
In short, can you just tell the procedure of ECT?
Okay. ECT is electroconvulsive therapy, which is a somatic or painless therapy, which is introduced by placing electrodes on the temporal region and by giving electric current. The range of current will be 80 to 120 volts and it is given for a period of 0.1 to 1 second. And the indications are, as I have told you, the indication is major depression is the most important indication, which there are suicidal ideas with the patient, so you need a speedy recovery. So again, schizophrenia, also paranoid, catatonic schizophrenia, ECT is indicated.
And what is the role of psychosocial therapies in the management of schizophrenia? And what are the types of therapies? Okay.
After drugs, ECT, psychosocial therapies also play an important part. There are variety of psychosocial therapies in which the skillful nurse interact with the patient to modify the behavior of the patient and to reduce the symptoms in the patient. For example, the therapies are behavioral therapy. Behavioral therapy is to modify the behavior, in which last year also you must have studied there are many types of behavioral therapies like a token economy, social skill training. Token economy means you are reinforcing the patient positively so that acceptable behavior is repeated in the patient. Then family therapy. Family therapy means you are involving or you are considering not only the patient but the family is also a client. The family is treated to cope up with the patient and also they are also involved in the caring of the patient. Then cognitive therapy, in which cognitive therapy, you use the cognition or the knowledge part and it will correct the judgmental errors in the patient, and also cognitive distortion is given to the patient. Then group therapy, individual therapy. These are all different types of psychotherapy in group. A group of patients, either all schizophrenic patients or different types of patients are given therapy. Then individual means one-to-one therapy is given to the patient for insight development and supportive therapy.
In what way group therapy is useful? Do you think a patient is more comfortable in a group therapy treatment part and feels that because one feeling is there, that group is there?
It is the responsibility of the therapist or the nurse to decide what is the condition of the patient, like whether the patient is ready for a group therapy or not. When the patient is in acute stage, of course therapies are not useful. Moreover, in psychotic patients, insight is not there. Means they are not aware that I am having some mental disorder. I need treatment. So with treatment, with drugs, with ECT, once the insight is developed, then patients are taken for therapies. And you have to decide whether the patient is tolerable or patient is ready to accept a group therapy. Till
It can be a mix of therapies also?
Yes, it can be a mix of
Okay.
therapies.
So it is actually at the point when you can say rehabilitation part is there, the therapies play more important role?
Maybe along with the other treatment also. Once the patient is having reduction of symptoms like hallucinating, not more hallucinating, or delusions are also not there, then that case you can start with the therapies, then it can continue during the rehabilitation period also.
Thank you for that. And let us now come to the nursing management of the schizophrenia, which is very important for you to understand, keeping in mind the types, signs and symptoms of schizophrenia and the medical management and the ECT, drugs used and the therapies which we have just now discussed. So let us come to the nursing management of a patient with schizophrenia.
Nursing management is the most important part we are concerned with. And it starts with the nursing process, like it is given in your book also. First of all, we take the assessment. Assessment of the patient comes like, first of all, you have to collect the data. And you will be taught how to collect the history of the patient, how to take the mental status examination of the patient. Like these are the important procedures psychiatric nursing involves. Then you will be able to collect the data. What are the things you have to collect, like what is the problem with the patient, how it started, and till what time it was the symptoms were present in the patient, and who brought the patient to the hospital, and does the patient have hallucination. Like according to the symptoms you have to go, like disorders of thought, disorders of perception, whether insight is present in the patient, disorders of motor activity. This will be given periodically to you, and you will be knowing how to collect the data in the patient. Then there will be family assessment. Family assessment is also very important because you should know how it all started. In the family assessment, it starts from the infancy state, like whether the patient, like going to the psychodynamics, you know that the relationship with the family, with the mother was very important. So you have to collect the data from infancy, like whether the child was wanted in the family, what is the order of the child, whether it is an unwanted child, girl child. Then what was the relationship? There was any pathological communication in the family, or there any pathological interpersonal relationship in the family, or any special events was there in the family which started the problem in the patient. Then like hereditary is also important. You have to assess whether any other family member had any type of mental illness, admission in the hospital or not. Then there will be environmental assessment. Environmental assessment includes what is the educational background of the patient, what is the employment history, whether he is continuing with the work or he is shifting jobs. Then patient has what was the IPR of the patient with the friends, with the colleagues, with the office staff. Is there any marital disturbances in the family with the patient? All this should be checked in environmental assessments.
So that means assessment of patient plays very important role in the nursing care. So like assessment of a patient, when we take the history from the patient, because when we see the signs and symptoms, is it it is not possible to take history or have the assessment from the patient in one go. So that means a nurse has to go repeatedly and I think have to use the therapeutic communication techniques also.
Yes, nurse has to know the phases of nurse-patient relationship, like starting from pre-orientation phase, introduction phase, working phase and termination phase. And she should apply all the therapeutic communication techniques like listening, observing, restating, reflecting, all these methods has to be applied with the patient. And it is not necessary that with one or two MSCs or with one or two mental status examinations or history taking, you will be able to collect the data in the patient. Periodical interviews are required to collect the data from the patient.
So shall we go to the next step, that is nursing diagnosis?
Yes. According to the collected data, now it is responsibility of the nurse to make diagnosis. First of all, withdrawn behavior. Withdrawn behavior related to disordered thought processes, feeling of fear, of suspicion, delusion and hallucination, misperceptions of environment or other persons. Like thought process, it is majorly a thinking disorder. So there will be delusions present in the patient. So delusions can be dealt with, already I said that patient will be saying, I am having this belief that people are trying to kill me, people are talking about me, and he may get preparations that to harm others. So the nurse should be very vigilant and careful, and first of all, you should not argue with the patient. When the patient is having delusions of grandiosity, I am so and so, I am Prime Minister, and if the nurse says no, how can it be? I know that you are not a Prime Minister. Then the patient may get irritated, patient may get violent. So you should not argue, but you should not reinforce also. You should not say, elaborate, okay, how you are feeling, like why should you feel that you are a president or a prime minister. That way you are reinforcing the delusions in the patient. Rather you should say, okay, you are feeling that way, you are thinking that way, and I know it is because of the symptoms. Then there will be suspicion in the patient. So one of the major factor in the nurse-patient relationship is make a trustworthy relationship with the patient. You should not give false reassurance. You should be giving such statements by which patient can develop trust in you. Be clear, be concise and be complete, and give short, small task to the patient which the patient can complete within the given time. So once he completes the task, he should be appreciated. That way you can develop self-esteem in the patient, and the fear will be going from the patient, and once the trust is developed, the suspiciousness also will go off.
Can you just give to our students example of nursing diagnosis after doing assessment? What diagnosis can be made by the nurses?
For example, about a disordered thought process, you can make the diagnosis as disorder of thought, delusion, delusion of grandiosity, delusion of persecution. Then you can say disorder of perception, hallucination, auditory hallucination present in the patient. So this way you have to make the nursing diagnosis. Now the next nursing diagnosis is low self-esteem related to inadequate interpersonal relationship, lack of successful coping strategies, delusions and hallucinations. So inadequate interpersonal relationship means in schizophrenic patients, their interpersonal relationships are very inadequate. They are not able to make long friendships with anybody. They are already aloof, they want isolated life, and they are taken withdrawal from the society. So it is very difficult for them to interact freely with others, and their self-esteem is affected. Yeah. And they have no self-confidence. Then delusions are already there, that people are talking about me, people are trying to kill me. So this will also reduce the self-esteem in the patient. Then disorientation related to disordered thought process, hallucinations or delusions, misperceptions of environment. There are all kinds of thought disorders in the patient, all kinds of perceptual disorders in the patient. So these all will give disorientation to the patient. Then potential of injury to self and others. That is very important. As I told you, due to delusion, patient may harm himself or harm others. So all precautions should be taken for such patients. Then especially for paranoid patients, catatonic excitement patients, you have to be careful with the patients. All the sharp instruments should be kept away from the patient, and you should be having continuous observation on the patient regarding the safety.
Even I think the bolts of the washrooms and the toilet should not be there, because patient can harm himself or herself
he can bolt it
in the hospital.
He can bolt the doors and harm himself. So you can observe that in all the mental hospitals there are no bolted doors. The next is hallucination or delusion related to disturbed thought process and disturbed perception. Like many times patient will say, I am hearing voices, and somebody standing in front of me. Patients will say, sister, see, my dead mother is standing in front of me. She is talking to me. Can't you see? The nurse will be confused. How can I respond? Then the nurse can say that I know that you are having these perceptual disorders. It is because of the illness. Even though I am not seeing them, but I know that you are seeing. This way patient will develop insight in himself. Then potential for disturbed homeostasis, because patient is not giving any attention to the personal hygiene, patient is not giving any attention to nutrition, so there will be altered homeostasis. So you have to provide adequate nutrition, adequate sleep pattern, and proper medications to the patient. Then there will be bizarre behavior, anxiety, agitation and aggression related to feelings of fear, lack of control over self, disturbed thought process. So these are all additional symptoms with the patient.
So now the next step is, we have diagnosed, and now the planning part. So how we will plan the care? There are certain goals which nurse has to set up?
Yes. Always we set up short-term goals and long-term goals. Short-term goals means which can be achieved immediately. For example, patient is not eating, and catatonic stupor patients, they refuse food and they are in the stupor stage, like they are not responding, they are not swallowing, they are not talking, they are mute. So your short-term goal should be maintaining the nutritional status of the patient. So in some such cases, either parenteral interventions can be done to the patient, or IG feeding can be given to the patient, so that your immediate goal, like giving nutrition to the patient, is met. Then long-term goal means which can be achieved later on. Once the patient is meeting with the immediate needs, then later on, how it will help him to recover completely, or how it will help him to go back to the pre-morbid personality. So that is long-term goals. So every action will have short-term goal and long-term goal.
And these are the goals for the nursing intervention.
Yes.
And what is the prognosis or the outcome of the schizophrenic and the in relation to the nursing intervention of the patient also?
Okay. Coming to the prognosis, like all mental illnesses, you can say they are curable. There is a misconception that mental illness are not curable. But why it is considered not curable is, first of all, the compliance of drugs is not there. Once the patient is not having any symptom, they immediately stop the medications. That should not be done. The medicines can be tapered, but that is only under the supervision of the doctor. Or you have to approach the doctor, consult periodically, then tapering of the doses can be done. Otherwise, continuous medication is a must in psychiatric cases. Then full support, family support is a must. Like when the patients get discharged, they are not accepted in their homes, they are not accepted in the society, they are not accepted in their office places afterwards. Everybody will point out that yes, he was a mental patient, and he will be ridiculed. So that should be avoided. In the rehabilitation period, the society should be prepared to accept the patient, to consider him as a normal human being, and also to increase his morale, increase his self-esteem by giving tasks to him, by involving him in the activities. Like a social skill training is also given to the patient during rehabilitation period. Like many times schizophrenic patients will be admitted for a period of, you can say, months together, years together. So they will be forgetting about the social skills which are acceptable in the society. So they will be given proper training for the fully acceptance of the patient.
That is rehabilitation of the patient, and
Yes.
the family, with the family support is very important, and even the support of the friend circle and the where the person is working.
Yes.
There is any chances of reoccurrence again?
Reoccurrence chances are very common. Because the reasons I told you, they do not continue with the
Yeah.
medications.
And the support of family and the environment.
Yeah. Environment will trigger the symptoms again in the patient.
So today we have seen the nursing management of a patient with schizophrenia. What is the type of schizophrenia, signs and symptoms in general, and types of schizophrenia, and the importance of medical and nursing management of a patient with schizophrenia, and how as a nursing personnel your role is very, very important in all the stages using the nursing process. Thank you very much, and I thanks Mrs. Annie Kumar on behalf of IGNU and all the students. Thank you.